I was diagnosed 5 years ago, March of 2005.
I was first diagnosed on August 31st, 2000.
I was diagnosed with breast cancer in March 2006.
And then I was diagnosed again in April of 2006.
I was called a few days later and told that I should come back in. So of course you're a little nervous when you get that second call. So I went in and had a sonogram that time. The technician was taking a lot of time exploring one spot and called in the person who was on staff, I guess the radiologist. And he came in and said, you know, I hate to tell you this, but I've seen plenty of these and I believe you have cancer. You need to call your doctor and get a biopsy. And they both left the room.
I was just beside myself. And then, I don't know, after about 2-3 weeks, I came to grips with it and I kind of pulled myself up and shook myself off and said, okay, I'm gonna beat this thing.
So I had a lumpectomy and the lymph nodes were checked at that time and there was no lymph node involvement. However, when he didn't get as big a clean margin around the tumor as he had hoped, so he recommended, after I saw him a few days later, that I go and have the chemo.
I had chemotherapy for 2 months. That was 4 doses every 2 weeks, and then a month to recover.
When they took the bandages off in the hospital, I looked down just to make sure they were really, really gone. And when I did, you know, I cried happy tears.
Women actually, even who've been through breast cancer, have no sense of what other women look like, or when a person is diagnosed and is told they have to have surgery, they don't have any sense of what are the possibilities of what they could look like and what the options are. So, you know, we very carefully chose the name Look Now because it means, you know, I'm here, I've been through it, and you can look at me.
It was nice to kind of think about, like, well, what do we want it to be, and how can it be about the women without being just about survival, to give women a chance to express themselves and be still beautiful, still be whole after this experience.
Just like that. Turn your head a tiny bit toward me. Okay. Can you just, with your body...
What I was hoping for in a photographer was really somebody who could put the person being photographed at ease immediately. So, you know, that's something where Angelica came to mind right away, because we've seen her work behind the camera. I'm very familiar with her work.
This project, I think, emphasizes what happens, especially to women after they have an operation, and how their identity as a woman is being challenged and certainly changed, I imagine.
I'm stronger, wiser, a little more patient about some things, but maybe less patient about other things that people let things annoy them, and I'm thinking, nah, it's not worth the hassle. But in terms of the physical body, the scars and the reminders are there that what I've been through.
And I guess I've just felt maybe more confident in myself, more secure in who I am as a person, as a woman.
The one thing it's done for me that I have actually become more feminine in the way I dress and the way I live my life.
This is something that you can get through, and it makes you a stronger person for it. You're part of a unique club of women who kind of have gone through it and just want to be out there to support others, to say, you know, you can do it. It's not easy, but you can do it.
Women younger and younger are getting diagnosed with cancer, and the treatment is better and better, right? So the recurrence doesn't happen and they live longer lives. But how do you live that longer life, and how do you live it fully?
If I can do anything to help other women through their own crisis and their own trauma, and that's part of my purpose, I guess.